Welcome to the deep dive. Today, we're pulling back the curtain on something pretty groundbreaking in healthcare.
Yeah, it really feels like a glimpse into the future, doesn't it?
It does. We're talking about AI, artificial intelligence, and not just, transforming things slightly, but really reshaping how we receive medical care.
Hmm.
And we've got this fascinating real-world example lined up.
Right.
Our mission for this deep dive is basically to give you a shortcut, a way to understand the profound impact of humans and AI working together in medicine.
And there are some surprising facts in here, some really crucial insights into, well, how these innovations are shaping tomorrow's health.
Yeah.
Today, really.
Exactly. And at the heart of it all, we've got these two figures. Dr. Shane, a really dedicated family physician,
Hmm.
and his, extraordinary AI companion, Heather. They're working together at a place called Havenwood Community Health Center.
And their story, it's really all about trying to make every single medical decision count,
Hmm.
making diagnoses more precise, and patient care truly personal.
Yeah, and what's so interesting here is that this isn't just theory, right? It's happening in a place that genuinely needs this kind of innovation community health centers.
Absolutely. These centers are often the first stop for care, sometimes the only stop for some of the most vulnerable people in our communities.
That's a great point. And when you picture Havenwood Community Health Center, it's more than just a clinic building. It's described as this vital artery,
Yeah.
a hub of hope and healing.
Yeah.
And you've got doctors like Dr. Shane, deeply committed, moving with this sort of practiced ease, but you can almost feel the immense pressure they're operating under. What are some of those pressures? What's the day-to-day reality like?
Well, the pressures Dr. Shane feels are unfortunately pretty common across the board in these settings. I mean, think about this. Community health centers served over 31 million patients just in 2023.
Wow, 31 million.
Yeah, the number alone is staggering. But what's really crucial is who they're serving. Get this. A striking 90% of those patients were at or below 200% of the federal poverty level.
90%.
And 67%, two-thirds, were at or below the poverty line itself. Just imagine that scale of need.
It's immense.
And the diversity is incredible, too. About 63% identify as people of color, something like 40% Hispanic, 17% Black, plus maybe 27% are best served in a language other than English. So right away, you have these unique, complex patient needs that are already straining a system that's, frankly, stretched pretty thin.
Okay, so you've got this incredibly diverse, vulnerable patient base. What other sort of systemic hurdles are clinics like Havenwood facing?
That's a good question. Because beyond the patient demographics, there's this pervasive workforce shortage. We're talking physicians, nurses, mental health providers right across the board.
Right, which means longer waits, more pressure on staff.
Exactly. It translates directly into extended patient wait times and just puts immense strain on the staff who are there. Then you layer on the significant burden of chronic diseases, diabetes, heart disease, obesity, which all demand really intricate ongoing care. And on top of that, behavioral health issues, things like substance use, mental health disorders, they're also becoming increasingly common.
And I imagine even when they want to innovate, the system itself can throw up roadblocks, maybe financial hurdles for new tech.
Seriously. Healthcare delivery can often feel fragmented, makes collaborating smoothly with specialists pretty difficult.
Yeah.
And while something like telehealth seems promising,
Yeah.
community centers face pretty big financial hurdles just maintaining the platforms and getting adequate reimbursement, especially in rural areas. That really limits the potential.
Okay.
And that's really why the arrival of AI, like Heather, is potentially so significant for places like Havenwood.
So enter Heather.
Right.
Described as this calm, clear, synthesized voice, processing info in real time, showing data, sometimes even like whispering insights. Her arrival sounds like a profound shift.
It really is.
How does an AI like Heather immediately start tackling some of those systemic inequities you just laid out?
Yeah, this is where you see AI potentially becoming a fundamental driver of health equity. Think about it. Dr. Shane and his team, they spend so much time on admin tasks.
Right, paperwork.
Summarizing notes, flagging missing info, trying to optimize scheduling. Heather automates a lot of that, which directly eases that massive burden on the human staff. It just frees them up.
Okay.
Plus, her ability to offer multilingual support and to simplify complex medical jargon, that bridges critical communication gaps, especially for patients who might struggle with health literacy or digital tools.
So the human touch gets amplified.
Exactly. It means providers like Dr. Shane can actually spend more time on the complex clinical thinking, the empathetic patient interaction, it amplifies their impact, particularly in those areas sometimes called healthcare deserts.
Mm.
So this kind of collaboration directly tackles those root causes of disparities, workforce shortages, language differences, even rurality.
That makes incredible sense. It's not just about being more efficient. It's shifting the focus back to direct patient care, that human connection.
Right.
So if Heather's helping with the admin load, what about her impact on something really critical like diagnosis?
Okay, yeah. This is where AI's precision can really shine. Let's take a scenario. Mrs. Anya Sharma, an elderly patient.
Okay.
She comes in with these vague symptoms, seemingly unrelated. Persistent fatigue, some joint pain, intermittent numbness. Dr. Shane runs the standard tests, but nothing really conclusive shows up.
Ah, the classic diagnostic dilemma. Happens all the time in primary care, I bet.
It does. It's frustrating for everyone.
Mm.
So what Heather does as this sophisticated clinical decision support system, she meticulously goes through Mrs. Sharma's electronic health records, past lab results, Dr. Shane's notes,
Mm-hmm.
and at the same time, she's accessing this vast, constantly updated medical literature database, including information on really rare diseases.
Yeah.
Her algorithms start identifying subtle patterns, things easily missed by human observation alone, especially when symptoms seem so scattered. And she flags a rare autoimmune condition that often presents exactly like that.
No kidding.
Then she suggests specific, maybe less common, diagnostic tests, like a particular genetic marker, and potential specialists to consult.
And what happened with Mrs. Sharma?
The diagnosis was confirmed. It ended months of uncertainty for her, allowed her to start the right treatment. But the really revolutionary part here isn't just finding a rare condition.
What is it?
It's that Heather effectively democratized specialized knowledge in real time. It's like bringing the expertise of a dozen specialists right into that family physician's office.
That fundamentally changes what primary care can even mean.
Exactly. It redefines comprehensive primary care.
That's incredible. And it goes beyond just diagnosing current problems, right? You mentioned proactive care. Tell us about Leo, the high school athlete.
Right, Leo. So he's this seemingly healthy kid, high school athlete, comes in for a routine checkup. But there's a family history of cardiovascular issues.
Okay.
So Heather goes beyond just his current state. She starts running predictive analytics, analyzing his genetic info, detailed family medical history, lifestyle factors, even subtle trends in his lab results over several years that might not raise a red flag individually.
So digging deeper than a standard checkup usually would, what did she find?
She flagged a slightly elevated risk for a specific cardiac condition, but years down the road. It wasn't something happening now, but a sophisticated risk assessment based on biomarkers and genetic predispositions.
Wow. So what do you do with that information?
Well, Heather suggested proactive steps, things like specific lifestyle modifications, maybe starting certain preventive screenings earlier than the standard guidelines recommend, or perhaps an early referral to a pediatric cardiologist just to get a baseline.
Imagine catching a potential heart condition years before it causes any symptoms.
Yeah.
That's not just prevention. That's like rewriting someone's health future.
That's exactly it. Heather allows this shift from just reacting to illness to proactively sort of sculpting well-being.
So with Heather providing all this diagnostic power, this predictive ability, how does that change Dr. Shane's role fundamentally? Is he becoming some kind of super clinician, or is it different?
It's really this augmented clinician model. It effectively extends specialist-level insights into underserved communities.
Right.
It democratizes that really specialized medical knowledge, making it accessible to GPs like Dr. Shane. It empowers them to manage a wider range of complex cases right there in the community clinic.
Which reduces the need for specialist referrals, potentially eases that bottleneck.
Exactly, and fosters health equity. It's a way to directly address the primary care physician shortage by boosting the capabilities and the reach of the doctors we already have.
That's a really powerful shift. Okay, so AI helps with diagnosis, prediction. What about tailoring treatment and, enhancing the actual care experience? How does AI move beyond just spotting problems?
Yeah, this is where personalized medicine really starts to take shape. Let's consider another case. Mr. Henderson. He's a long-term diabetic.
Okay.
And he's facing real challenges, managing his condition, adhering to medication, partly due to lifestyle, other health issues. His current treatment just isn't getting the optimal results.
A very common, often frustrating scenario in chronic disease care.
Absolutely. So what Heather did here was a really deep dive, analyzing Mr. Henderson's unique genetic information, his biomarkers, other conditions he has, how he responded to past treatments, And crucially, she integrated real-time data from his wearable device, things like activity levels, blood oxygen.
Wow. Okay.
Based on all of that, Heather generated this highly tailored treatment plan. Specific medication adjustments, very precise dietary recommendations, even an optimally designed exercise routine for him.
That's incredibly specific.
It gets even more nuanced. She could potentially identify psychological states that might predict when he's likely to struggle with adherence, maybe through subtle digital biomarkers like typing speed on his phone or even voice patterns.
Really?
Yeah, to then trigger what are called just-in-time adaptive interventions. Basically, highly personalized support delivered exactly when and how he needs it most.
And the outcome for Mr. Henderson?
Significantly improved blood sugar control, better overall well-being. It just shows AI's potential to optimize treatments and minimize side effects through truly customized care. It's like having this hyper-attuned, dedicated health coach working alongside the doctor.
That's incredibly impactful. What about reaching patients outside the clinic, bridging some of those practical barriers people face? Tell us about Maria.
Right, Maria. A young mother struggling with medication adherence, mainly because of a super demanding schedule, family responsibilities, plus she was more comfortable communicating in Spanish.
Okay, multiple challenges there.
Definitely. So Heather stepped in to boost her engagement and adherence. She set up intelligent medication reminders through Maria's mobile app,
Yeah.
but not just static reminders, they adapted dynamically to her routine.
Smart.
And she also facilitated communication through an AI-enabled patient portal, using sophisticated natural language processing and, importantly, multilingual support.
So it was more than just a translated message.
Oh, much more. Heather could answer Maria's health questions in Spanish, simplifying complex medical information in a way she understood. She tracked adherence patterns, flagged any inconsistencies so Dr. Shane's team could proactively reach out. She could even suggest, gamified approaches to make tracking things more engaging.
And the result for Maria?
A big improvement in her medication adherence. And just as importantly, Maria reported feeling more empowered, more engaged in her own healthcare. It really shows how AI can bridge those language and literacy barriers, creating a more inclusive, effective healthcare experience.
These benefits, they sound truly revolutionary. But for this kind of personalized medicine to really work, especially using all the sensitive data, you mentioned something called explainable AI, XAI. Why is that so critical?
Yeah, XAI. For AI to gain and maintain trust, it's basically an ethical must-have. Patients fundamentally have a right to understand how an AI system influenced their diagnosis or treatment plan.
Right. You can't just have a black box making decisions about your health.
Exactly. Many complex AI systems, especially things like deep learning models, can operate like black boxes. It's incredibly hard to see the step-by-step process of how they reached a conclusion. Their workings are opaque. XAI is all about making those processes transparent. It's essential for getting genuine informed consent from patients. It's critical for identifying and addressing potential algorithmic biases, and it's absolutely key for preserving that vital doctor-patient trust when you're dealing with highly sensitive personal health data.
That makes sense. Without that clarity, that explainability, all these amazing benefits could be undermined if people just don't trust the technology.
Precisely. Trust is foundational.
Okay, so that transparency is vital. Now, Dr. Shane, even with all the help Heather provides, he's still reflecting on some pretty critical considerations, right? In this human-AI partnership, what are the key challenges they're navigating?
There are definitely several crucial aspects. First off, data privacy and security. It's paramount.
Of course.
Heather is processing enormous amounts of incredibly sensitive patient data. So you need robust encryption, really secure data storage, strict access controls, adhering to all the regulations like IPA that's non-negotiable.
And vetting any third-party AI vendors involved too, I imagine.
Absolutely rigorous vetting.
Yeah.
Then there's the issue of bias. We hear a lot about algorithmic bias in AI generally.
Yeah, how does that play out here?
It's a major concern. If the data used to train the AI lacks diversity, say, it has fewer data points from women or certain racial minorities, the AI might end up being less accurate or could even make harmful recommendations for those underrepresented groups.
So you have to constantly watch for that.
You do. It means actively monitoring for biases, making sure your training data sets are diverse, conducting regular audits to ensure equitable outcomes across all patient groups. It's an ongoing process, not a one-time fix.
And for the patient themselves, their right to know, their autonomy remains central.
Unequivocally, informed consent is key. Patients must know if and how an AI system played a role in their care, and part of Heather's function, or systems like her, should be assisting in generating clear, accessible explanations of what the AI does and its limitations, so patients can give truly informed consent.
Okay. And then there's the really tricky question of accountability, right?
Right.
What happens if an AI is involved in an error or an unexpected negative outcome?
Yeah, this is a complex and rapidly evolving area, legally and ethically. When an AI system contributes to an error or an adverse event, figuring out responsibility is at the AI developer, the doctor who used the AI's output, the hospital or clinic. The lines are still being drawn. It really highlights the need for clear institutional policies,
Wow.
strong oversight committees involving healthcare professionals, ethicists, patient advocates, and it underscores again that human oversight remains absolutely critical. AI doesn't remove responsibility.
Which leads perfectly into this fascinating scenario you mentioned, a moment of doubt for Dr. Shane. Can you walk us through that?
Sure. So there was the patient presenting with symptoms that Heather, based on the data, initially flagged as a pretty common, straightforward condition, standard stuff.
Okay.
But Dr. Shane, drawing on his years of experience, that human intuition, may be picking up on subtle nonverbal cues from the patient. He just felt something wasn't quite right. He questioned Heather's assessment.
Ah, that gut feeling. So what happened? Did Heather just get overridden?
Well, this is where explainable AI comes back in. Heather, being designed with XAI principles, didn't just give a diagnosis. She immediately provided the reasoning behind her conclusion. She displayed the supporting data, the probabilities. But crucially, she also highlighted the inherent limitations of her current model and the data she processed. She essentially said, here's why I think this, but here are the boundaries of my certainty.
So she explained her thinking. And what did Shane do then with that info and his own intuition?
Shane, using his deeper contextual understanding, his empathy, factoring in things Heather couldn't quantify, he made the call to override her initial suggestion. He ordered an additional, less common test,
Ah.
and that test revealed a rare underlying condition that Heather's model had missed, probably because it hinged on a subtle, non-quantifiable element that only human intuition could really pick up on at that stage.
Wow. That really underscores the indispensable role of that human element, doesn't it? It's not AI or human, it's the synergy.
Exactly. It powerfully reinforces that AI is a tool, an incredibly powerful tool, but it's there to assist, not replace, human judgment.
I mean, sometimes I can barely remember where I parked, let alone integrate years of experience with subtle patient cues. It shows what humans bring.
It really does. This scenario validates that human clinical acumen. It underscores why the hybrid approach, combining AI's data processing power with the human's interpretive framework, empathy, and compassionate care, is really the gold standard for patient safety and trust.
Right.
AI excels at patterns in vast data, but clinicians bring irreplaceable qualities. Empathy, understanding the social and emotional context, ethical reasoning, reading those nonverbal cues. Relying solely on AI carries real risks, like those biases we talked about, or that black box problem if there's no explainability.
And thinking about medical error, this adds another layer of complexity, doesn't it?
It does. While AI might help reduce certain types of human error, it can introduce new ones, especially those stemming from algorithmic bias. So accountability for AI-assisted decisions becomes really complex.
Yeah.
It demands more than just technical fixes like XAI or better data sets. It requires robust ethical guidelines, clear legal frameworks, and, really importantly, continuous education for healthcare professionals on how to use these tools responsibly.
Okay, so looking ahead then, what's the big picture? The transformative impact we can realistically expect from partnerships like Dr. Shane and Heather's. What have we really seen?
Well, summarizing the benefits we've touched on. Definitely improved diagnostic accuracy, catching things earlier, more precisely, even rare diseases. We're seeing the potential for highly personalized treatment plans that truly optimize outcomes for individuals. Patient engagement and adherence seem significantly enhanced, especially when AI helps bridge those communication gaps. And critically, those administrative efficiencies are real, freeing up doctors and nurses for more direct patient care.
And the key takeaway seems to be that AI amplifies human ability.
That's the core of it. Heather doesn't replace Dr. Shane. She gives him more time, more mental bandwidth for that essential human connection, which, at the end of the day, is still the cornerstone of effective healthcare.
And thinking further out, what's Dr. Shane's vision? His hope or where this leads?
He's really hopeful about AI further democratizing healthcare access, especially getting expertise into rural and underserved areas.
Right, bridging those geographic gaps.
Exactly. Making specialized care more accessible, regardless of where someone lives or their socioeconomic status. That aligns perfectly with reducing health disparities and really fostering health equity. And systems like Heather are designed to continuously learn and improve,
Hmm.
which means the standard of care itself should keep getting better over time.
But, and this seems crucial, this promising future absolutely has to be built on a strong ethical foundation.
Absolutely non-negotiable. Transparency, fairness, accountability in how AI is developed and deployed, these are essential to safeguard patient rights, to mitigate those biases we discussed, and critically, to maintain public and patient trust as AI becomes more woven into the fabric of daily medical practice. It has to be about technology serving humanity, not the other way around.
The story of Dr. Shane and Heather really does offer this compelling glimpse, maybe even a blueprint. It seems the future of medicine isn't just about the fanciest new tech, but really about how that technology empowers us to deliver more human, more compassionate care. So, as you, our listener, consider these incredible advancements AI is making possible in healthcare, maybe think about this. What does it make you wonder about the evolving definition of expertise, especially in a world where human intuition and machine intelligence are starting to converge like this?
That's a deep question.
And maybe also, how do we ensure those irreplaceable human elements, empathy, ethical reasoning, that gut feeling Dr. Shane had, how do we make sure they remain right at the very heart of healing, even as technology keeps expanding what's possible? Something to think about.